Good evening, the concerned parents of autistic kids. I am psychologist Sakshi from ND Care, which is known to provide the best treatment for autism around the globe. Today, I will be discussing about what is socialization, its definition and nature, why it is important, causes and symptoms of socialization in which the individual lacks, agents, types, mechanisms, significance, challenges, implications for contemporary society at large, how we can improve socialization. So what is socialization? Socialization is multifaceted process through which individuals learn and internalize the values, norms and customs and behaviors necessary to function within the society. This is a complex phenomena not only shapes personal identity but also ensures societal continuity by transmitting culture across generations. This document will develop into the concept of socialization, its mechanism, agents, types and significance, as well as its challenges and its implication in contemporary society. Definition and nature of socialization. Socialization is a lifelong process through which individual acquire skills, knowledge and behavior necessary for effective participation in social life. It begins at birth and continues throughout life, adapting to the changing roles and expectations at different life stages. Sociologists and psychologists alike emphasize its dual role as a tool for personal development and as a mechanism for societal integration. Socialization is a fundamental process through which individuals learn and internalize the values, norms, behaviors, and social skills necessary to function within the society. Various researchers have explored this concept, each highlighting their complexity and multifaceted nature. Emile Durkheim, a pioneer in psychology, emphasized the role of socialization in maintaining societal cohesion. He argued that through the transmission of collective norms and values, socialization ensures the integration of individual into a shared moral framework. According to George Herbert Mead, a symbolic interactionist, introduced this idea of self-developing through social interaction. According to Mead, socialization is an interactive process where individuals acquire their sense of identity by engaging with others. Third is Sigmund Freud, a pro-socialization from a psychoanalytic perspective emphasizing the role of internal psychological mechanism. He posited that socialization helps balance innate desires and societal expectations, creating a well-adjusting environment. Freud's concept of the id, ego and superego provide insight how individual conflicts are managed during the socialization process. Contemporary researchers such as Annette have expanded on traditional theories by examining the influence of social classes on socialization. In a sense, socialization is a lifelong process influenced by various agents, including family, peers, education, media, and culture, by facilitating the transmission of societal knowledge. Now, the key characteristics. First one is lifelong process. Unlike education, which is formal and time-bound, socialization occurs continuously from infancy to old age. Second is cultural transmission. It ensures the preservation and dissemination of cultural practices and beliefs. Third is bidirectional nature. Individuals both are influenced by the society in which they live. Fourth is adaptive process. It evolves with changing societal norms and individual circumstances. Now, why socialization is important? Socialization is essential for individual and society as it serves multiple critical functions that ensures both personal development and social cohesion. Its importance can be understood through the following key aspects. First is development of identity and personality. Socialization helps individuals develop their sense of self, identity and personality. Through interaction with family, peers and the community, individuals learn who they are, how they fit into the world. Second is learning social norms and values. Socialization is a process by which individuals internalize societal norms, values and expectations. By learning acceptable behavior, individuals are better equipped to interact with others, contribute to group harmony and avoid conflict. Third is facilitating social interaction. Through socialization, individuals become integrated into the fabric of society. It fosters a sense of belonging and helps people understand their roles and responsibilities within various social institutions such as the family, workplace, and the community. Fourth is transmission of culture. Socialization enables the transfer of culture, traditions, and knowledge across the generation. This ensures the continuity of societal values and practices, while also allowing for the adaptation and innovation over the time. Fifth is promoting social order. By instilling discipline and conformity to societal rules, socialization minimizes deviant behavior and maintains order. Institutions like schools, religious, and laws act as agents of the socialization, helping individual align with societal expectations. Sixth is building relationships. So, socialization teaches individuals the skills needed to form and maintain relationships. It fosters communication, empathy, and cooperation, which are essential for the personal and the professional success. Seventh is preparation for roles. Socialization equips individual with the knowledge and skills required to perform various roles in the society, such as being a parent, employee, or a citizen. This preparation is both that individuals and society crucial for personal and the professional development. Now, what are the causes and symptoms of a lack of socialization? A lack of socialization can result from various factors, which may be personal, social, or environmental. These causes can be impact an individual ability to develop relationships, adapt to social norms, and functions effectively within the society. Below are some key cases. First is psychological emotional issues, mental health disorders. Conditions like anxiety, depression, or autism spectrum disorder can hinder social interactions by making communication and engagement challenging. Next is low self-esteem. A lack of confidence may discourage individuals from seeking social connections, leading to isolation. Next is social environment, family dynamics. A lack of family support or dysfunctional relationships can result in poor socialization during formative years. Cultural or linguistic barriers. Differences in language or cultural norms can isolate individuals within the community or the society. Next is isolation and loneliness. Geographical isolation, living in remote or sparsely populated area can limit opportunities for the socialization. Social exclusion. Experiences of discrimination, bullying, or stigma can lead to withdrawal and avoidance of social situations. Fifth is educational and developmental factors. Limited exposure. A lack of access to diverse social settings such as schools or community groups can hinder social development. Poor role models. Inadequate guidance or negative influences during childhood may impair the ability to form healthy relationships. Sixth is economic constraints. Poverty. Financial hardships can restrict participation in social network, in social activities, reducing opportunities for the interaction. Workload pressure. Excessive work demands leave little time for building and maintaining social connections. Seventh is traumatic experiences. Abuse or neglect. Past trauma can lead to mistrust or fear of others, discouraging social interactions. Loss of loved one. Grief and mourning may result in the withdrawal from the social life. Eighth is health issues. Physical disabilities. Certain conditions can make it difficult to access social space or engages in the activity. Chronic illnesses. Long-term health problems may limit energy and motivation for the socializing. Addressing the cause of limited socialization offers involving targeted interventions such as therapy, community programs, or creating inclusive and supportive environments. These efforts can help individuals overcome barriers and foster the meaningful connections. Now, symptoms of lack in socialization. A lack of socialization can manifest in various symptoms affecting an individual emotional well-being behavior, effective well-being behavior, and ability to interact with others. Below are common symptoms of insufficient socialization. First is emotional symptoms. Feeling of loneliness, low self-esteem, anxiety or depression, lack of empathy. Second is behavioral symptoms, social withdrawal, difficulty in communicating, inappropriate social behavior, over-dependency on solitary activities. Third is cognitive symptom, poor conflict resolution skills, limited perspective, difficulty adapting to social cues, struggles with recognizing and responding appropriately to social signals or expectations. Fourth is physical symptoms, health issues, high risk of stress-related conditions such as heart problems or weakened immunity due to a lack of emotional support. Now, fatigue or lethargy, reduced motivation or energy, often linked to feelings of disconnection. Fifth is social symptoms, limited friendship or relationship, few or no close connection with others, resulting in a smaller support network. Difficulty in building the trust, reluctance to form meaningful bonds due to the mistrust or lack of experiences, fear of rejection, avoiding interaction due to the fear of negative judgments or exclusion. Sixth is impact on daily life, poor academic or work performance, struggles with teamwork, networking, or collaboration in professional academic environment. Increased dependency on technology, using virtual interaction as a substitute for face-to-face communications. These symptoms can vary in severity depending on the duration and underlying causes of insufficient socialization. Recognizing these signs early and seeking support through therapy, social skills training, or community engagement can help mitigate the effects and improve social well-being. Now, what are the mechanisms of socialization? Socialization operates through various mechanisms that help individual integrate into the society. These mechanisms are broadly categorized into two. First is observation and imitation. Individuals, especially children, learn by observing and mimicking the behavior of others such as parents, peers and role model. Second is direct instructions. Explicit teaching of norms, values and rules by authoritative figures like parents, teachers or mentors. Third is reinforcement and punishment. Behaviors are shaped through the positive reinforcement, rewards, and negative reinforcement of punishment for the undesirable actions. Fourth is role playing and interaction. Experiencing different roles and scenarios help individuals understand societal expectations and adapt accordingly. Fifth is internalization. Over time, individuals internalize societal norms and values, which become part of their beliefs and system. Now, agents of socialization. Agents of socialization are the entities that individuals during the socialization process are influenced. They are categorized into the primary and the secondary one. The first is primary agent, family and the peers. The foundation agent of socialization, instilling basic values, language and the social norms. Peers also play a critical role in shaping behaviors, especially during the adolescence. Second is secondary agents. Schools teach discipline, cooperation and the societal roles. Mass media influences attitudes and perceptions through the exposure to various cultural narratives. Religious institutions impart moral values and spiritual guidance. Workplace shapes professional identity and adherence to organizational culture. Now, types of socialization. Socialization manifests in various forms, each serving distinct purposes. First is primary socialization, occurring during early childhood when individuals first learn fundamental norms and values. Second is secondary socialization. Involves learning appropriate behavior within the smaller groups or institutions such as schools and the workplaces. Third is anticipatory socialization. Preparing for future roles by adopting behavior and attitude associated with those roles. Fourth is resocialization. Occurs when individuals undergo significant changes requiring the unlearning of the previous norms and the adoption of the new ones, often sees in the context like rehabilitation and the military training. Fifth is gender socialization, the process through which individuals learn the gender roles expected by the society. Sixth is political socialization, the way individuals develop their political beliefs and values. Now, significance of socialization. Socialization is indispensable for both individual and society development. For individuals, facilitates personal growth, identity formation, and emotional well-being. Helps in acquiring essential life skills and coping mechanisms. Second is for the society. Ensure cultural continuity and social stability, fosters social cohesion and collective identity. Now, what are the challenges in socialization? Despite its critical role, socialization faces numerous challenges in the modern world. First is cultural diversity and the globalization. Exposure to diverse cultural may lead to conflicts, norms and values. Second is technological advancement. The rise of digital media has altered traditional socialization patterns, particularly among younger generations. Third is social inequalities. Disparities in access to quality education and resources impact the effectiveness of the socialization. Fourth is changing family structures. The rise of single parent household and non-traditional families affects primary socialization dynamics. Now, the implications for the contemporary society. The changing landscape of the socialization has profound implication. First one is education system. Need for inclusive curriculum that address diverse cultural backgrounds that promote global citizenship. Second is workplace dynamics. Emphasis on diversity training and fostering intercultural competence. Third is digital literacy, equipping individuals with skills to navigate and critically evaluate digital media. Fourth is policy interventions, implementing policies to reduce inequalities and enhance opportunities for effective socialization. Now, how we can improve the socialization? Improving socialization involves developing communication skills, building confidence, and actively seeking opportunities for the interactions. Here are strategies to enhance socialization. First is develop communication skills. Practice active listening, pay attention, maintain eye contact, and show genuine interest in others' conversation. Improve non-verbal communication. Use positive body language such as smiling and open gestures to convey approachability. Expand vocabulary. Improve your ability to express thoughts and clearly and confidently by reading and engaging in discussions. Second is build confidence. Smart small, role playing, celebrate small wins. Acknowledge progress such as initiating a conversation or making a new acquaintance. Third is expand your social network. Join clubs or groups. Participate in activities that align with your interests such as sport team, hobbies, clubs, or the group activities. Attend social events. Go to the gathering, meetups, or community events to meet new people. Reconnect with the old friends. Rebuilding past relationships can provide a supportive environment for the social growth. Fourth is seek professional help. Therapy or counseling. Work with a therapist to address underlying issues like social anxiety or trauma. Second is social skills training. Attend workshops or the classes that focus on enhancing interpersonal skills. Support groups. Join groups for the individuals with the similar challenges to share experiences and learn coping strategies. Next is embrace technology positively. Use social media wisely, connect with others who share your interest with balancing online interactions. Sixth is practice regular interaction. Engage in daily activities, everyday activities. Use daily opportunities such as grocery shopping or commuting to practice small tasks. Volunteer. Helping others can provide a sense of purpose and foster social connections. Be curious. Ask questions about others, experiences, or interests to keep your conversation engaging. Seventh is improve emotional intelligence. Develop empathy. Try to understand others' perspective and emotions. Second is manage emotions. Learn to control negative emotions like anger, frustration during the interactions. Next is foster a positive mindset. Avoid negative talking, self-talk. Replace thoughts like I am bad at socializing with affirmations such as I can improve my social skills. Be patient. Building social skills takes time, so celebrate progress and keep practicing. Next is step out of your comfort zone. Try new experiences, attend unfamiliar events, or explore new hobbies to expand your exposure to diverse people. Take initiative. Don't wait for others to approach you. Be proactive in starting conversation or inviting people to the activities. Next is cultivate gratitude and kindness. Express appreciation. Thanks others for their time, help, or kindness to build stronger relationships. Offer help. Acts of kindness creates a natural basis for the forming the connections. Improving socialization is a gradual process that requires a consistency and effort. With patience and persistence, anyone can develop the skills and confidence needed to thrive in the social environment. Now, I would like to conclude. Socialization is a cornerstone of human development and societal sustainability. Its dynamic nature ensures that it evolves with changing time, reflecting the complexities of modern life. By understanding and addressing the challenges within the process, societies can foster an environment that nurture individuals can promote collective harmony. Socialization is vital as it bridges the gap between individual needs and societal demands, ensuring that both individuals and societies thrive. Thank you everyone. It was indeed a great honor and privilege to share my candid views and perspective on an important concern like socialization. Please do share your valuable experience and feedback to make our efforts fruitful in dealing with autism. Thank you.